Hepatitis refers to an inflammation of the liver. Hepatitis can be caused by a number of different factors, such as by hepatotropic viruses, autoimmune mechanisms, reactions to drugs or toxins, or secondary to other systemic disorders. However, hepatotropic viruses are the most common cause of hepatitis. There are 5 main types of viral hepatitis known as types A, B, C, D, and E. They differ in their mode of transmission and incubation period, mechanism, degree, and chronicity of liver damage, and ability to evolve to a carrier state. In this video, I will discuss the pathophysiology, epidemiology, and clinical signs and symptoms with a focus on hepatitis B. In 2017, there were 5,961 notifications of hepatitis B. As we can see in Figure 2, the highest rate of notification was in the 30 to 34 year age group, and prevalence was higher in males than females in all age groups except the 20 to 34 year olds. As seen in Figure 3, notification rate of hepatitis B has been decreasing in the past 10 years, with a steady sharp decline in the last 5. Rates of hepatitis B are higher in Aboriginal and Torres Strait Islander people than in other Australians, except in the 0 to 4 year age group. Across 2007 to 2010, 7% of all Australian notifications and 4.4% of hospitalisations were reported in Aboriginal and Torres Strait Islander people. The overall Indigenous to non-Indigenous rate ratios were 3.1 to 1 for notifications and 2.2 to 1 for hospitalisations. The liver has a wide range of functions, including detoxification, protein synthesis, and the production of bile, which is essential for fat digestion. The liver receives a dual blood supply from the hepatic artery and the hepatic portal vein. The hepatic artery carries oxygenated blood from the aorta to the liver, whereas the portal vein carries blood containing the digested nutrients from the entire GI tract, the spleen, and pancreas to the liver. The liver is divided into 4 lobes. These lobes are subdivided into lobules, which are the functional units of the liver, which contain millions of hepatocytes. Situated around the perimeter of each lobule are branches of the hepatic artery, hepatic portal vein, and bile duct. These cluster together at the corners of the hexagonal lobule, forming the portal triad. Each lobule is centered on a branch of the hepatic vein called the central vein. The hepatitis B virus is spread when blood, semen, or other bodily fluid infected with the hepatitis B virus enters the body of a person who is not infected, such as having sex or sharing needles with an infected person. Medical professionals are at risk due to needle stick injury with an infected individual. Hepatocytes are the target of the hepatitis virus. The virus binds to a receptor on the hepatocyte and enters the cell via endocytosis. The way the virus is detected and eliminated by the immune system creates the clinical features called the prodromal, icteric, and recovery phases. The prodromal phase is the beginning of an acute hepatitis infection. Acute hepatitis B is silent and most infected people are asymptomatic. However, in this phase, the presence of the virus in the blood can activate macrophages, neutrophils, epithelial cells, and endothelial cells to release the inflammatory chemicals called interleukin-1 and tumour necrosis factor. These chemicals create flu-like symptoms such as fever, chills, myalgia, joint pain, nausea, headaches, and anorexia. Then, gradually, the body's host responds by releasing virus-specific cytokines which signal the cytotoxic T lymphocytes to be recruited to the liver. In an attempt to kill the intracellular virus, the hepatocytes themselves are also destroyed by the T lymphocytes, causing hepatocellular damage, which leads to the icterus phase. When the hepatocytes are destroyed, they release the enzymes that were present inside them: alanine aminotransferase and aspartate aminotransferase. In this phase, patients may have right upper quadrant pain due to inflamed liver and tension on the membrane around the liver. Jaundice, which are yellow manifestations in the eyes and skin, occur because the infection of the liver affects the biliary tree, causing the yellow bilirubin to spill into the blood, resulting in increased conjugated and unconjugated bilirubin levels in the blood. High levels of unconjugated bilirubin creates dark urine. Following the icterus phase, most patients will move on to the recovery phase where the body clears the virus and symptoms improve. However, hepatitis B virus can produce a carrier state in which the person does not have symptoms but harbours the virus and can transmit the disease. There are 2 types of carriers: healthy carriers who have few or no ill effects, and those with chronic disease who may or may not have symptoms. Chronic hepatitis can lead to liver cancer or cirrhosis. While damaged hepatocytes can regenerate, in cirrhosis the liver's connective tissue regenerates faster. Liver function is significantly impaired and the liver becomes fibrous with scar tissue. The scar tissue also obstructs blood flow throughout the hepatic portal system, causing portal hypertension, which can lead to ascites, which is buildup of fluid in the belly.